Dr. Anthony Fauci, the White House Chief Medical Advisor. Doctor, very good to have you with us. Thank you.
Thank you, Neil. Good to be with you.
What do you make of this trend here, demanding masks indoors, whether you have the virus or not, whether you've been vaccinated or not?
Well, Neil, as you know, the general CDC guidelines still hold that you do not need to wear a mask indoors if, in fact, you've been vaccinated. But what's very clear is that at the local level, in the trenches, as it were, you're seeing individual situations where the level of infection is so high and the level in the community of vaccination might be low, that the local authorities, be they the health authorities, health officials in places like Los Angeles County, which is, one of the first that came out and said, regardless of what broader recommendations are, we feel the better part of valor is that we have so much infection going on with this Delta variant that it's prudent even for those people who have been vaccinated to wear masks. And I think we're seeing and will see more and more of that, because we certainly are seeing a surge in cases with the Delta variant, which is now dominating in this country 83%, and in some places in the country it's as high as 90%. So it's quite understandable, Neil, why local authorities are now saying, good that you're vaccinated, but in a situation where you have people indoors, particularly crowded, you should wear a mask.
Do you think, though, that it's going to have just the opposite effect on incentivizing people to get vaccinated, Doctor? That the vaccinated could say, well, why the heck did I go through this to be vaccinated? I have to wear a mask with the guy next to me who hasn't. And then the person who hasn't been vaccinated says, all right, well, look at the guy next to me. He's wearing a mask, too. So what good? What do you say?
Neil, I don't think that that's really necessarily the case, because getting vaccinated is not just so that you don't have to wear a mask. Getting vaccinated is to protect your health, that of your family, and that of the community. And when I say the community, it means by not allowing the spread of infection or allowing yourself, maybe inadvertently and innocently, to be a vector or a carrier to the virus to someone else. A very stunning statistic that might answer your specific question, Neil, is that if you look at the number of deaths due to COVID-19 in the United States, 99.5% of them are among unvaccinated people. So getting vaccinated is not just about whether you have to wear a mask or not wear a mask. It has to do with something much more serious than that. And that is keeping you healthy enough that you don't wind up in the hospital and you don't wind up dead. Because if you look at the statistics, they are very compelling.
The statistics are interesting, too, when you look at the progression of this variant, Doctor. And I noticed in Israel earlier on, when the Pfizer vaccine started, it was about 97% effective in dealing with the virus. Since June 6th and the Delta variant, its effective rate has gone to 64%, still impressive. But people are going to be reading and seeing that and saying, wait a minute, maybe these vaccines can't handle this thing. Why should I get it?
Yeah, good points asked often, so very relevant to ask it, Neil. One of the things you need to start off with is that even though in some of the studies that you have correctly quoted, is that if you look at the protection against symptomatic or asymptomatic infection, it looks like that has gone down some, particularly with the preliminary data that we're seeing from Israel. The thing that has held strong is the protection against hospitalization and death. So even in those situations, you get a very, very high level in the 90% of protection from hospitalization and death. So even though people may look at that and say, well, what's going on there? There are a bit of a decrease there. That does not mean that you're not getting a profound degree of protection against severe disease when you get vaccinated.
Now, whatever recommendations you have, and I know you always relay they're personal and you work in coordination with the CDC and everyone else to try to have a coordinated policy response. What did you think of Senator Cotton today, sort of lumping you in with advisors who advise, but they don't decide? What did you think of that?
I'm not sure what the context of what he said, Neil, was. He lumped me with advisors. Well, I am an advisor. We make advice, and the ultimate, for example, the recommendations come from the CDC. If you listen to the things that I have been saying over months and months and months, invariably, they have been in support of the CDC guidelines, and that's the job of the CDC as a public health agency. They have a lot of very qualified epidemiologists there. They look at the data and they make guidelines based on the science. What I do almost invariably is to support the work of the CDC.
So I just read from that, Doctor, it might have been me making the leap, that you can recommend and then give any type of advice you want, but ultimately mayors, governors, the politicians, elected officials are the ones that will pull the trigger on this. And it's stating the obvious, I guess, but do you think he was zinging you personally?
You know, I don't know if he was, Neil. I really can't figure that out. I hope he wasn't. There's nothing personal about this. This is a public health issue, and we're all working together against a very common enemy, and that is the virus. So as a researcher, my job, which we did, I believe, very well, was to develop the vaccines that have now saved millions of lives, but to also do the kinds of interventions and ultimately give advice because of experience in public health. But you're right, the ultimate decisions is what's made at the local level. For example, right. I think one of the things you just mentioned, which is a good example, the CDC could say that if you are vaccinated, you don't need to wear a mask indoors, but they give a great deal of discretion locally. So if local officials say, we do or do not want to make a mask mandate, or we do or do not want to make this recommendation, it's up to the local officials to do that.
You know, the NFL is now sending a warning because of the COVID outbreaks that non-vaccinated players could lead to forfeiture of games, and it would be on their dime if that happens. What did you make of that?
You know what I think we're seeing, Neil, is that there is a push towards giving people somewhat strong incentives to get vaccinated. I think people are very, understandably, very shy about, if you want to use that word, that's probably not the right word, but reticent may be better, are very reticent to be mandating things like vaccines because generally there's a pushback on that. So what we're seeing is an indirect way to pressure people in a positive way of saying that, you know, if in fact you're unvaccinated and you get infected, that's on you. And I think that's what the NFL is doing. So it's a way of functionally mandating without explicitly mandating.
If we don't see more people vaccinated, Doctor, and for whatever reason, there's a stubborn third of all Americans who are in that camp where, for one reason or another, they don't plan to get vaccinated, what happens?
I think then we have a serious problem, Neil, because if you don't get the overwhelming proportion of the population vaccinated, you will have the continual circulation and replication of the virus in the community. There are enough unvaccinated people that this could go on for a considerable period of time. There will be hospitalizations, there will be deaths, and every death and every hospitalization, particularly every death, is a tragic, avoidable phenomenon. Because if people got vaccinated, you can see from the numbers that I gave you that 99.5% of the deaths are among unvaccinated people. That's the first unfortunate thing that would happen. The second is that it would give the virus, by allowing it to circulate continually without crushing it completely, it would give the virus the opportunity to continue to replicate and mutate. And when viruses are allowed to mutate, not every mutation turns out to be a functionally consequential mutation. But every once in a while, you'll get a mutation that leads to another variant. And the next variant might be more elusive against the vaccine. And it may be that the vaccines don't do as well against the next variant. We've been very fortunate in that even though we have a very formidable and dangerous variant with the Delta, we still know that our vaccines do pretty well against that variant. What happens if you get a variant that is so different that the vaccines don't do well? And that's a risk if we allow the virus to circulate freely, particularly among unvaccinated people. So that's yet again another incentive for people to get vaccinated, not only for their own safety, which obviously is very important, but the safety of their family and in general, the safety of the entire community.
You know, Doctor, we've had a back and forth week with some politicians, particularly over the issue of the source of this virus sort of occurred in a Wuhan lab, and accepting your word that this was not something Machiavellian on your part. Joe Rogan wrote in the Washington Post today, the foreign policy columnist, that what everyone can now see clearly is that the NIH was collaborating on risky research with a Chinese lab that had zero transparency, zero accountability during a crisis. No one in a position of power, he says, addressed that. Fauci is arguing the system worked. It didn't. What do you make of that?
Yeah. You know, it's more complicated than that, Neil. I don't know if we can explain it in the brief period of time we have. If you look at the research that was done, it was research that was highly recommended by peer-reviewed, our United States peer reviews. It got a very high score in the peer review system. And the purpose of the research was very, very clear. It was to try and determine what was out there in the bat population that might be ultimately risky for us. It was done in the context of trying to find out what the precise environmental bat source was of SARS-CoV-1 so that we could prevent SARS-CoV-2. So it was research that was done by qualified people. Right now, when there's all of this thing about China, that's a different situation now. Back then, when you were dealing with qualified, highly respected Chinese scientists. So it isn't what was made out to be about dealing with really, really bad people, because those scientists were very well respected in the scientific community, internationally. And you could just ask.
But in retrospect, Doctor, and I know you've been asked and got very heated, in retrospect, looking back at that funding role, do you regret that, knowing what has transpired since? Not that any of your decisions might have led to the very outbreak of a virus over which you've argued many times you had nothing to do with, but that it shows that the Chinese, even to this day, reluctant and refusing to go back to those origins. Was it worth it in retrospect?
Well, you know, the idea and the scientific decision to look and screen in the place where the viruses emerge was a good, proper scientific decision. The one thing none of us like is what this has all turned into, which is something that is just very complicated and very, I would say confrontative, which it really should not be.
But even nasty, right, Doctor? I mean, even nasty. Just now, I mean, Congressman Madison Cawthorn has said that if Republicans gain control, he wants you investigated for being a pawn of the Chinese government. Rand Paul all but blamed the deaths of all these people worldwide on you, even though he backed off of some of that.
Yeah, I would hope so.
Thinking about what you got involved in with President Trump in the beginning when all of this started, did you, and have you ever gotten to the point where you just want to say, the hell with it? I don't need this.
No, I'm a scientist, and my job, which I'm doing, which we've done, was to develop the vaccines that have saved millions of lives already, is to be a scientist and a public health official. I certainly don't like how all this has turned out to be so contentious. I mean, and when a congressman makes a statement that, I forgot what it was, that if they take over the House in 2022, I should be criminally investigated. On what basis is he making that comment? And Neil, I mean, you've got to get realistic about that. I mean, yes, we had somewhat of a confrontation with Senator Paul because of the, I think, inflammatory statements that he made about lying, but where do you come off about talking about criminal things and conspiring?
Do you think any of this comes back, though, Dr. Amin? You challenged President Trump at the time on a couple of things. You weren't in your face about it. You questioned some things. And this all emanates from that, and that it still lingers to this day.
Yeah. Neil, I really want to concentrate on my job as a scientist and a public health official. But you asked the question, I'd have to give you an honest answer. I think there's no doubt that because I had to speak the truth during the Trump administration, which at times was contrary to President Trump, that annoyed a lot of people who got very upset with me. But I wasn't doing anything personal. I was just trying to speak the truth about what was really going on with the outbreak. And it was nothing at all against President Trump. And in fact, if you look at the record, I have never said anything derogatory against the president. I was only talking about correcting misstatements about the science. I had nothing against the president at all, not at all. And he knows that. In fact, he even says that at times. But when I was saying things that this is not going to just disappear, that this is not going to just go away, that we do have a very serious problem, that annoyed a lot of Trump loyalists. I'm very sorry that it annoyed them, but it is the truth. And that's what I was trying to do and still do, is to tell the truth.
Any regrets?
I never have a regret about telling the truth or about doing my job.
Dr. Anthony Fauci, thank you very, very much. Very good talking to you, sir.
Thank you, Neil. Thank you for having me.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.